Hello friends, Namaskar to all. Today I will be putting forward explanation of a very important rubric mentioned in the repertory, and there are various sub rubrics mentioned under this main rubric. The rubric is death. In this main rubric there are sub rubrics, and I'll try to explain few of the sub rubrics practically how to use these rubrics in your daily practice. So broad rubric is death, and under that there is one rubric, death contempt of. So what is the meaning of this rubric? Death contempt of. What do you mean by contempt? Contempt is a situation you where you do not have that respect towards anything. So this particular personality, opium, doesn't have that respect towards death. Usually we are so much scared about death. It is a human tendency. Everybody is scared of death. Nobody wants to die. But this opium personality, because it has that danger, lack of danger wali feeling, that he doesn't have that feeling of danger. So in this particular syphilitic state, this opium goes into a state of contempt towards death. Death conviction of. So here in this rubric, death contempt of, this opium will act very rashly. He will never care about what is going to happen to him, what is going to happen to his life. So he'll never ever care. This another rubric is death conviction of. What do you mean by conviction? Conviction means when there is a belief that something is there and there is no need of evidence or no proof is required. So this is conviction. Conviction means when you are doing certain things with conviction, it means you are very much sure that you can do particular thing. And conviction means when you are very much sure, आपको पक्का पता होता है कि ये यही चीज है. This is conviction. So death conviction of, here the patient is very much convinced. उसको पता होता है कि that he is going to die. So this is death conviction of. So there are 15 remedies mentioned in this. These remedies you can use when the patient says that Dr. Saab, I am very sure that I will be dying. So I have to die. So this, when there is this belief is there in the patient that he is going to die, or there is unshakable belief. You try to convince him, you see, it is not like this, but still that patient will be sticking on to his belief that he is going to die or he is dying. So this is death conviction of. So there is a morbid feeling of death which is surely to come. Okay. Then there is rubric death desires. Death desire means there are various situations in the life of people where out of so much suffering, out of so much agony, out of so much humiliation, out of so much despair, they feel that there is no use to live. So they want to die. So there is, but they do not have any action. It means that there is only a thought process that because there is so much disturbance in my life, I do not want to live. So they'll pray to God that हे भगवान मुझे उठा ले, कुछ ऐसा हो जाए that I should die, कुछ ऐसा कर दे कि I could suddenly die without any pain. So these are the thoughts where you can take this rubric as death desires. Then death desires despair from. What do you mean by despair? Despair is a situation where you lose all the hope. When a patient is losing all the hope and he feels that situation is not going to improve, so there is no positivity in the perception of the patient. He always feels that always something bad is going to happen. Always there is negativity in the situation. So there is no hope whatsoever. So this is a state of hopelessness, which you call it as despair. So death, desire, despair from. Remedy is creosote and ozone. Okay. Then another sub rubric is death desires dishonored instead of being. When the person feels that he cannot bear the least amount of insult, he cannot bear even slightest embarrassment, he is not able to bear any humiliation, any mortification, that much sensitivity is there in a particular personality, ignis alcohol. So he has this sensitivity that instead of being dishonored, I have this particular honor, and the sense of honor is so high that instead of getting dishonored, instead of getting humiliated, he would prefer to die. So this is the rubric which you will use. Death, dying sensation as if. So this rubric you will find in many of the acute cases. Okay, as a syphilitic entry point in acute case, you can use this rubric when a patient is having a feeling that he is dying. So the word used here is dying. Dying means the situation is happening just now. It is present tense. It is continuously happening. So this is dying sensation as if. So because of any pain, a person says that हे भगवान मैं मर रहा हूँ इस दर्द से. ओके, इस दर्द की वजह से मैं मर रहा हूँ, इतना इस दर्द ने मुझे परेशान कर दिया है. So like when there is some acute pain abdomen, when there is headache, so a person may say that कि मतलब अब तो मरने वाला हूँ मैं, इतना तेज दर्द है सर मुझे. So this is the dying sensation as if. Okay. So there are 10 remedy mentioned in this rubric. Use accordingly. Death, presentiment of. What do you mean by presentiment? When you have the feeling that something bad is going to happen. So this is presentiment. So presentiment means when you feel beforehand, when a patient is having a feeling that by any means patient has an intuition that he is going to die. So this is death, presentiment of. Pre means before, sentiment means when there is a feeling that that patient is having a feeling that he is going to die, and he is trying to predict it. So this is death, presentiment of. Then death, presentiment of, calmly thinks of death. So here, even though he knows that death is approaching, death is near, but still he is in a state of calmness. This is again a kind of syphilitic state where in this particular state, a person should be in a state of panic, but here the patient is in a state of calmness. So this becomes very peculiar. Then another rubric is death presentiment of predicts the time. Here this rubric becomes further syphilitic when he even says that at this particular hour I'll be dying. So there are 8 remedy mentioned in this particular rubric, sub-rubric, where person or the patient clearly says that in this particular time he will die. So it becomes more syphilitic rubric. Death sensation of. Okay, what is this? Sensation always comes when there is some external factor which is triggering you. So sensation means when something comes from the environment and your system tries to interpret it. Okay, so here this patient is feeling, because of certain triggering factor, that death is, that he is approaching death. Okay, so there is death at the present moment. He feels that, feeling that he is dying. This is death sensation of. So this is very superficial feeling of death sensation of. It is a very superficial rubric. You can use it in acute cases. Death talks of. So this rubric is more of a psychotic rubric, or because of hysteria a person is talking about death. Okay, so this is to be used when the patient constantly talks about death. The topic of conversation, when you are talking with this patient will always, from one way or the another, will be talking about death. Okay, so either this is because of hysteria, as in the case of Moschus, which is syphilitic, or either because of gaining attention, as in case of Spongia or Vanilla. So this rubric you have to use accordingly. Then death thoughts of. When a person is having those thoughts that he is going to die, or he is thinking about death, what is death, he is either thinking philosophically about death. So this is again a psychotic rubric, death thoughts of. Okay, so friends, I think today this rubric I was able to explain. So please use in the daily practice, and let me know how and in what ways you used this particular rubric, the version of the patient also. Just post few comments. It will be learning for me also. So please keep sharing. Thank you.